with Dr. Kramer from over at Murphy Wainer, and going to talk about football season coming around. First of all, think about football. What hits me right now hard, hits the kids hard, and anybody hard, the heat and humidity. Right? How do they battle that? How do they get around that heat and humidity?
You're right. I mean, it's an issue in the summer, no doubt. In this area, in this climate, heat and humidity is an issue. So we battle number one by trying to determine what the heat index is. There are certain criteria when it reaches a certain heat index that we basically shut it down. A lot of times we get around that by trying to do early morning workout sessions or practices or late evening practice sessions in the summer. Obviously, it's all about hydration, so we make sure we keep plenty of water around. Then we do have emergency services available where we have ice baths and ways to cool kids down if need be.
You think about the hydration. What is best? You hear about water, you hear about Gatorade, something even about tea. Among those, what's best for the hydration?
Water is really the best thing to do. There are a lot of electrolyte replacement fluids out there. I think they have their place. Personally, I like to basically take Gatorade and sort of half water, half Gatorade and dilute it to some degree. I think the electrolyte replacement does have some benefit. But really, we pretty much push water more than anything else. Tea, I wouldn't recommend that as far as hydration. Obviously, no soda. Pretty much water, and then I like diluted Gatorade more than straight Gatorade.
Is there anything you give a player if they become dehydrated? And sometimes I've seen these thicker fluids they have to give them quickly. You got to get some glucose back in the system pretty quick if they get dehydrated.
I mean, if somebody gets profoundly dehydrated and to the point where somebody's having a hard time taking in fluids orally, sometimes, we do have to resort to IV fluids, but most times you're able to hydrate kids even when they get dehydrated and have issues of heat and illness just by taking, significant fluids by mouth orally.
What's the difference between heat exhaustion and heat stroke?
So heat exhaustion is a milder form of heat illness. An athlete was going to feel, somewhat fatigued. They're going to still be sweating. They're going to be feeling thirsty and getting on the verge of dehydration. They have their mental faculties are completely intact. So someone who's out on a hot day recreationally that just feels like you're overheated per se, that's heat exhaustion. Heat stroke is starting to get into what is truly a medical emergency. At that point, you may be not thinking clearly. You're going to actually stop sweating. You're going to have a profound sense of feeling thirsty. And when those types of symptoms start happening, it is a medical emergency, and oftentimes we do summon emergency personnel. You're talking about ice baths, aggressive cooling techniques to get an athlete to cool down.
Yeah, I hear a lot about that over the years. When somebody's not sweating, that's a definite warning sign.
Correct. That is a definite warning sign. If that's happening, it's an emergency. It needs to be addressed immediately.
So it's one of those things, if you're sweating, that's a good thing. That's your body's cooling system, isn't it?
Correct. Sweating's a good thing. So sweat on the surface leads to evaporation and cooling by surface. And so sweating is a good thing. That's how your body responds to dealing with heat stress.
Do they have any written recommendations about how many water breaks to take or when to take water breaks during these practices at all?
They do recommend breaks. Honestly, the athletic training staff would know the specifics to that because I'm not really involved in practice sessions so much. I know based on the heat index, there are recommendations of certain water breaks. It's not like the old days where going to get a drink or rehydrating was a sign of weakness. That is a very outdated sort of fallacy. Now, water breaks are mandated, and we go out of our way to make sure kids are getting hydrated. If they're being instructed by a coach, to not drink because they're, not being strong enough, that's not a good thing. So being hydrated is extremely important, particularly in this time of year.
Notice in the East-West All-Star games, they were taking some extra breaks just for that, looked like that particular reason to get some fluids in the kids that they needed.
That's exactly correct. So that there is mandates. The athletic training staff at each of the high schools, they have very kind of specific protocols they follow in practice sessions. And at games, if it does get that hot, oftentimes that can come into play.
Remember back in the day, which probably would be, I know it's considered taboo now, people probably won't even believe this was in existence, but back in the day, they give you about a 20-ounce or 24-ounce Coca-Cola cup full of these salt tablets and take 4 of these per day. I know they don't do that anymore.
Correct.
You think about that had to be crazy what they were doing with us back then.
Yeah, so the theory was that when you're losing fluids, you're losing salt, and salt in your system helps keep internal water inside. And so there was, in the old days, there would be salt tablets, and they would be recommended to be taken salt tablets. That is shown not to be safe and not a healthy thing to do, so we don't recommend that anymore. You can do electrolyte replacement with salt, sodium, with Gatorade, which is part of the reasoning behind that. But the heavy salt loads like those days, that is not recommended nor done anymore.
See, one thing crazy too, they used to give us that warm salt water. They put salt in the water. When you went for your water break, you're not drinking pure water.
Correct.
You're drinking salt, warm salt water.
It's the same idea to try to get sodium or salt into your system to hopefully replenish your fluid and not lose it as much. But that's been shown not really to be necessary, and we don't do that.
A lot of guys wouldn't drink the water because it didn't taste good because it was warm salt water. So they wouldn't drink any water anyway.
Correct.
It defeated the purpose completely.
Correct.
Well, you look at the All-Star games. There was an injury in the All-Star game pretty quickly. I think a big lineman from the West team, I think a kid out of East Surrey, he got hit pretty quick in the game. He was out there and gone. He was on the cart. Those injuries, I don't know what happened to that kid. It might have been a leg or ankle injury. It was taped up, I guess, in the lower leg, but they had to cart him off. Do you remember that injury in particular?
Yeah, exactly. We were there to help manage that. So unfortunately, the athlete did sustain an ankle injury. We were able to immobilize the ankle on the field. We were able to cart him off the field and then the privacy of the locker room. We do have the technology now to where we use portable ultrasound. So with our portable ultrasound unit, we can utilize that technology and look at the bone structures with an ultrasound machine, and we were able to determine in the locker room that he had sustained a fairly significant ankle fracture. He was then immobilized, put in a temporary splint or cast, given crutches. He would have followed up with his home orthopedic doctor, sports medicine doctor. Most likely that athlete, very well would have needed surgery. We were able to avoid getting an x-ray or going to the emergency department because he had the utilization of the ultrasound equipment, which has dramatically changed a lot of our on-field management of determining whether or not an injury really is a bone fracture or not.
Looking at the game and then the players as a whole, the games come to the practices starting. What all is involved in these pre-practice physicals? What all is involved in those?
So in all states and in the state of North Carolina, any student athlete starting from middle school age through high school has to have a yearly pre-participation physical examination. And it's an examination done by a healthcare provider to really determine the fitness of an athlete as far as any underlying physical issues or any underlying medical issues that even could include a family history of heart disease. So it's a screening examination to determine whether or not a child has or is at risk for having, let's say, an undiagnosed heart condition, or if they're coming off a recent injury and they're just not fit or well enough to compete in their sport. So it's every child, every student athlete, all through high school gets a yearly physical. And it does pick up certain things where we would not allow a student athlete to participate because of certain risk, particularly as it relates to a heart history or a cardiac history.
That heart history's got to be a crucial thing right now, I'm sure, with these young kids, especially when they get that first physical, probably coming from middle school. I guess the schools and the doctors, they would keep records of those kids year to year after that, but that heart's got to be a key thing.
Yeah, we do keep records, and a lot of it really falls on the history. A family history is important. History of any heart or cardiac symptoms with an examination that, for instance, may reveal a heart murmur when you listen to the heart sounds. Those types of things we try to investigate and make sure that there is no heart condition that would put the student athlete at risk playing their sport. Unfortunately, it's a very difficult thing to determine or to find, and so unfortunately it does not catch everything, but it definitely has validity and has been shown to help with the overall fitness of athletes in this state for sure.
I'm sure it's changed over the years. It used to be come in, get the height, the weight, and maybe take the blood pressure, then move on out. But nowadays you probably got to check the limbs and the body and bone alignment to some degree too, to make sure they're all in place.
That's true. It's a focused examination, but we focus it on the merits of determining the health of an athlete as far as playing their sport.
And you look at the upcoming practices and things starting up. Once you get a certain injury, maybe say injure the ankle or the knee, does that make that part of the body more susceptible to future injuries? Like I've seen ankle injuries sometimes, you get those, and it seems like the first time you get it, you survive it, but then on, it might be a little bit weaker in the future.
There is some truth to that, so it's important anytime you have an injury to appropriately rehabilitate the injury. So in some instances, that body part is at higher risk for recurrent injury, but really, when the main thing that we see and the concern we have is if somebody, let's say, has an ankle injury and they're not quite back, they're maybe trying to play with protection, either taping or bracing, and they have a little limp. What tends to happen is they're at higher risk for an injury in another body part because they're not 100% confident. You're trying to protect that body part, and it increases the risk of injuring something else.
It's all about that overcompensation, isn't it? Trying to compensate for the problem, and you hurt the other body part probably.
That's correct.
Yeah. Now, do they still have the pre-wrap? You go in, you get the ankle pre-wrapped, and then you get the ankle taped up, and you come out to practice, get that tape cut off, give you a pair of scissors, learn to cut your own ankle tape off, stuff like that?
Yes and no. There's lots of debate as we talk about ankles and protecting ankle sprains or recovering from an ankle sprain, the validity and the effectiveness of taping versus bracing. There's been lots of studies now that have shown that ankle braces, oftentimes we use a lace-up type ankle brace, they can be easily retightened and re-snugged up, and so they can be manipulated in the course of a practice session, whereas taping is a one-time thing. It's been shown to actually loosen, and so over a practice or a game session, it's not as effective as the game goes on. So we're starting to move away from taping and really starting to use more bracing. It's been shown to be more effective.
Like you say, you got to get that brace nice and snug for those Velcro straps to tighten in tight, I guess.
Correct.
Gotcha. Now, you think about the practices that come out, things like that. Let me go back to the injury. I'm going back. I looked at an old tape last night. A young lady who used to be in Guilford County Sports Athletics. She was a softball player. Now she just became an assistant softball coach at Wofford with the Terriers. And she was injured back in high school. Let's see if you remember this injury. Remember Kara Shutt? She hurt that foot. Southeast Guilford basketball player.
Yes.
She mentioned Dr. Kramer took care of that
Yes.
foot, broken bone. She's
Yes.
going for 1,000 points in her career and got I think she was at 997, right before 3 points for 1,000.
Yes.
And you went in and took care of that foot. But I thought it was kind of interesting. I was looking at the old tape last night because you just got that softball job. I was going to see if you remember that injury back in the day.
Yes. So, basketball, lower extremity injuries are common. So whether it's knee, foot, or ankle, those are a lot of the injuries we see in basketball. Certain injuries recover and do just fine. Certain injuries are more severe that may need surgery. It's all a part of having an athletic training staff on site, recognizing the injury, and our easy access to be able to make an appropriate diagnosis and get an athlete fixed appropriately, so that we're trying to diminish any long-term problems. That's the goal.
What do you think the most common injuries are in football? I know there's a bunch of different things you could injure in football.
So in high school football, lower extremity injuries, knee, ankle, foot, is the most common musculoskeletal or orthopedic injury. It's been shown in some recent studies that the most common reported injury in high school football is actually head injuries / concussions.
It's getting to be serious business there then.
Yes.
Is that the kind of thing the orthopedic surgeon, orthopedic doctor, would they look at those type of injuries too, concussions?
So an orthopedic surgeon, orthopedic doctor is going to deal with musculoskeletal, the limb injuries. Typically, orthopedic surgeons do not get involved in the management of concussions. They may in the acute setting in an in-game situation, but the subsequent management is going to be done either by a primary care physician, a neurologist, or in my case, a primary care sports medicine physician. So our background is not only orthopedic type injuries, but we also have a lot of background in the medical care of athletes, and concussions fall into that sort of category. And so primary care sports medicine docs are well versed dealing with concussions. It's something that I do and we do in our office all the time.
And your typical high school trainer or high school attending trainer would have to be versed in that too, I'm sure. To have
Correct.
All these different
So
things.
we work hand in hand every single day with the certified athletic trainers we have at our high schools in the management of concussions, making sure the athlete is held out of competition and practice until they have gone through the return to play protocols. And a lot of that is initially managed by the physician, but then the day-to-day management is by the athletic trainer. So there's lots of communication back and forth with the training staff as it relates to concussion management and getting the child back to play.
Let's reference back and kind of look back at something. You said earlier about the temperature, about the heat and humidity. Who again administers that call, that decision about when not to practice, when to practice, or when to maybe even be in a practice and stop a practice? Are you guys involved in that, or is that the school's decision?
The certified athletic trainer on site at the school, yes.
And they've got equipment now too that they use to monitor those things, don't
Yep. So they've got heat bulbs. There's different ways to monitor certain heat index measures, and so oftentimes in this time of year, the trainer will do some measurements using this. It's a type of heat bulb index that can kind of coordinate what is essentially the heat index, looking at the heat and humidity, and at certain benchmarks, practice will be canceled or not allowed to take place if the risk is too high.
Some days it may be a fact with the coach or the staff. We're trying to we can't get a practice in because maybe the heat and humidity. Then also you got to deal with these lightning and thunderstorms too, I'm sure.
Well, that's correct. And, this day and age now, and particularly, for instance, in the East-West All-Star game, that was delayed because of a passing thunderstorm and lightning in the area. And there are criteria. We all on our phones, the trainers in particular, have lightning apps now where you can turn on the app and you can get a sense of where the closest lightning is. And then when it's deemed safe, a contest can be cleared to be played. So there are lightning apps. So we manage all those things too, and that's obviously very common in the summertime with summer thunderstorms.
Going to go for a question out of left field, kind of going left field. What about with the Grasshoppers? Were you involved any at all with the left fielder Jack Herman, who got injured in that game probably a couple months back? He broke his tibia and fibula in the same doggone game, and it had to be terrible because they went up in the outfield to make that catch game. That might have got caught on the fence or something, broke the fibula and the tibia in the same play. Well, it had to be crazy.
So he had a severe fracture of his ankle. Fortunately, we were able to summon EMS immediately. Our medical staff met the athlete and the athletic trainer at the local hospital in the emergency department. It was clear that there was a significant ankle injury. X-rays were obtained. Our surgeon, Dr. Landau, got involved. We did an initial procedure to stabilize the bones with what's called an external fixator. There was so much swelling that we had to use instruments outside the lower leg to keep the bone secure. So we at least addressed that acute situation. That athlete, under the parent club of the Pittsburgh Pirates, saw the team orthopedic surgeon in the Pittsburgh area. My understanding is he's had 2 subsequent procedures. He's now doing physical therapy and rehabilitation. He's doing well, but it was probably one of the worst injuries, in-game injuries I've seen in my career covering baseball, and I've been doing minor league professional baseball now for 30 years.
Wow, that's pretty rough to hear about that.
Yeah.
What do you think about the rehab and recovery time, and will he be able to return any time down the road?
Minimum 1 year.
1 year.
The goal is to get him back to pre-injury competition level. Whether that will happen or not, it's really hard to predict. But with aggressive physical therapy and rehabilitation, we're hopeful that he'll be able to get back and play next season. But it's a 1 year recovery.
In a case like his, he's probably back home in his hometown, I guess, now where he's from.
Correct. He's probably getting supervised physical therapy under the Pittsburgh Pirates organization. Oftentimes, a lot of the Grasshoppers athletes, when they have extensive rehabilitation, they go down to their spring training site down in Florida, and that's where a lot of the rehab takes place with their medical staff there.
Let's go back and kind of wrap things up with Dr. James Kramer, Murphy Wainer Orthopedic Specialist. Recommendations for the high school players as they get set for the upcoming season. What kind of recommendations for these players as far as being ready for the season, getting those things done, all that checklist? Get these. What should they be doing right now?
Well, the number one error is don't take the summer of being away from your sport and return on day one of practice deconditioned. That's less common now than it used to be because summer football takes place, particularly with 7-on-7, and there's off-season weight training and conditioning, so that's not as much of an issue as it used to be. But maintaining conditioning is number one. Number two, as we talked about early on in this interview, is, and you get back and start practices in early August and it's hot, is you've got to focus on not only hydration but appropriate nutrition. So hydration and conditioning is the main thing. Those are the two things you really need to focus on.
And you got to be careful too, because sometimes it's hard to eat after these practices. Sometimes all you want is fluids. I guess you got to maintain a proper diet too.
Oh, that's true, and that's important. You have to have fuel to run your body. So proper nutrition is very important, and particularly in the high school population, that doesn't always take place. So we try to educate high school athletes on nutrition. The trainers at our schools tend to do that, and so appropriate healthy eating and hydration, it's important. Sometimes easier said than done.
If they have any questions, they can always go by your website, I'm sure, Murphy Wainer Orthopedics Specialist website, check in there, and also be aware of the doctors at the different schools. Dr. Kramer, thank you for your time today as always. Excellent work. You passed the test. You got the part right about the young guy from the East-West game. You're on top of that, on top of Kara Shutt, on top of Jack Herman. So we didn't miss anything at all day. Good job. We see you again soon.
Thanks so much, Andy. I appreciate it.